right, well, welcome to the last presentation of the day so far. Our moderator today is going to be Sarah Behrens, and she was able to reconnect just now. So, Sarah, you're muted. There you go.
Yeah. Hi, Linda. Hi, Alice. Thank you
Hi.
both for joining us today. I am going to introduce the two of you. You guys are going to be speaking on the OASIS Parent Training model, which is very exciting. And if anybody has questions throughout the session, please feel free to use the Q&A on the right-hand side of your screen. And Alice and Linda, would you like to answer questions throughout the session, or would you like to wait towards the end?
I'm fine answering it throughout. Alice?
Okay.
Yeah.
Okay. Well, I'll let you guys know if questions come in, and then we can pause and take those as we receive them.
All right, sounds good.
All right.
Well, welcome to the OASIS Parent Training Program. This is a line of research that is near and dear to my heart. So we'll be talking a little bit about the actual OASIS Parent Training itself, and then what we've done in the meantime to scale it up. Before we get started, I'm Linda Heitzman-Powell, and I am the principal investigator on the OASIS project and have been since about 2005 as we've developed and tested and now are at the point where we're disseminating the OASIS Parent Training. Alice, she is more recent to the team. She's been with me how long now? 3 years? Alice?
Yeah, it's been 3 now.
Yep, and came as a Lend postdoc and has kind of stayed on and has jumped right into the OASIS Parent Training Program. So she's going to be helping me present today. Well, I'm going to do a little time machine here and say pre-COVID, right? Because if you think about it, we've been working on the OASIS Parent Training Program for about 10 to 15 years now. And pre-COVID, back in the day, geographic isolation was a significant barrier to accessing treatment. We know that there's a huge percent of our population, 60 million people to be exact, that live in rural areas of the United States alone. That's over 20% of our population, right? So 20% of our population don't have access to the same kind of resources that we do in more urban areas. The thing is, children in rural areas are just as likely to have autism as their urban counterparts. And part of the challenge that I have seen over the course of working in the field of behavior analysis and autism is that families face significant challenges back in the early days accessing services, right? Whether or not it was being able to have access to a BCBA or being able to have access to well-trained service providers. There just were not resources in these rural areas, right? ABA professionals were really less accessible. And because they were not as accessible, the parents themselves didn't have access to any kind of training to be able to help them learn how to better parent their child with autism. So back in the day, I worked with Matt Reese. Some of you on here may remember Matt. He was such a kind and gentle leader for the CCHD here back in the day. And one of the things when I was a Lend student was parents were coming in, they were getting diagnosed with autism, and then they were handed a packet of paper and sent on their way. And I said to Matt, Matt, that's untenable that we have these families that have gotten this at the time devastating diagnosis for their child, and we don't have any support for them. What we should have is a parent training program that can help augment treatment, so where parents can become informed and they can become an integral part of their treatment team, because parents are the natural community for their children, right? It's through parent training and education and support that we're going to improve the generalization of skills. And Matt said, well, Linda, why don't you write a grant? And so that's what I did. And that was the origin of the OASIS program. at the time, what we did, we had this provider training, and parents, because they were so eager to learn some of these strategies so they could be better parents as teachers for their kids with autism, they were attending that provider training. And so what what Jay Bazart and I did at the time was we wrote to NIDLR, the National Institute on Independent Living and Developmental Disability Rehabilitation Research, say that fast 4 times, to take that training that we had developed that was designed to teach providers base skills, which now is synonymous with RBT training. Parents were going through that so they could learn these basic skills to be better able to parent their child with autism. And so NIDLR funded us to take that training and revise it so that it was more applicable to parents. So we came up with more parent-friendly scenarios. We still used the same language, with the premise being that if you have a child that has cancer, you become familiar with the terminology of cancer. If you have a child with ADHD, you become familiar with the language of ADHD. So if you have a child with autism, you need to become familiar with the language of autism and the language of applied behavior analysis. So we kept the language the same. We did add glossaries in there, and we actively teach parents what these terms mean. So the OASIS stands for Online and Applied System for Intervention Skills. And so what we do is we have online training where parents learn the knowledge and the concepts, followed by a hands-on behavioral skills training approach where parents are coached to use that particular strategy with their child in real time using distance-based technology. Because our whole goal with this parent training back in the day was to be able to reach families in all these geographic areas that didn't otherwise have access to services, right? So because my colleague, Jay Buzz, his area of expertise is in sound, strong instructional design, what we know is that active participant responding produces the best learning. So our online tutorials are developed with that in mind. So you get a couple of slides of texts, right? Followed by a question or a feedback slide where you have to engage in active responding to what it was that you just learned. So subsequent to that, you would attend a telehealth, at the time called telemedicine, coaching session where you're delivering that behavioral skills training via distance-based technology. Now, this will become a little bit more important when we start talking about the coach training, but I can tell you that as a behavior analyst at the time, a BCBA, who had a history of working with families in home, training service providers, it's really easy to say, do it like this, and you model it, and then they imitate your model. Well, when you're doing things via distance-based technology, you can't really do a model very well, except for maybe a video model, which we've embedded in there. And so part of what we do in our coach training, which Alice will talk about in a little bit, is we provide our coaches coaching and feedback on their ability to use their language to walk parents through the application of that particular skill. And so here is an example of what it would look like, the OASIS Parent Training. And let's see how it works.
This is a mock video of a OASIS coach provide training to a parent and child while the parent and the child is at home. And then the provider is also at home. So it's totally distance-based. But at the same time, just want to mention that OASIS parent training can be also delivered in person.
Okay, Tiffany, so we're going to get a little extra practice with work.
I'm turning it up.
Working with with Boston. So what we're going to do is a token board restricts access to the reinforcer, so he has to earn that reinforcer by the tokens. So I can see that you have your token board there, great, and you already have your, great job, 4 spots, perfect, and he's gonna earn the last token. So once Boston earns that last token, you're gonna make sure that you give him that descriptive label praise, you're gonna give the token along with the reinforcer, and you're going to continue to use those skills that we learned before. So making that SD and statement form, not asking questions, and don't forget to describe the token system to Boston before you get started. We're going to practice this skill and then I'm going to walk you through it. Ready to get started?
Yes.
Okay, go for it.
All right. Okay. Here we go. Clap hands. Nice job clapping your hands, buddy. You did it.
Remember, Tiffany, we want to make sure that we describe the token system first to Boston before.
Oh, okay. All right, I'll try again.
You did a really great job, though, making that demand in statement form, though.
Thanks. Okay, here we go, buddy. Let's try again. Sorry. Okay, so you have to earn your last sticker to get your book that you picked earlier. Okay? All right. Clap hands. Good job clapping your hands, buddy. You did it.
That looked really great, Tiffany, but don't forget to give him that token. So you really want to pair the token with the book.
Okay. Can I read the book to him for a second?
Yeah.
Oh, then we'll do it again? Okay. On Wednesday, Danny Dozer and Luke Loader help make the library bigger. Danny clears the construction site. Luke lifts heavy loads with his big bucket. Do one flap. These bricks will be used for the new building. Okay, let's try again. Okay. All right, so remember.
Starting with 4 again. Nice work.
Okay, remember, you have to earn your last token to get the book. Earn the book. Yeah, we'll read it. We'll read it. All right. Up your hands. Good job.
Sean, I just got feedback that I need to mute. Are you guys getting feedback?
I think the video was like echoing a little bit.
All right.
Clap your hands. You got your tokens. You got all your tokens. You get a book. You.
That looked really good, Mom. I loved that descriptive praise. You told him what he did a good job doing. You paired the token with the reinforcer. You gave the SD and statement form, and you explained the token system. Excellent job. Great.
So one of the things that I want to say before Alice takes over and moves on is that the for those of you that are familiar with direct instruction, capital D, capital I, the parent training was developed based on a direct instruction approach. So Cassie at this point has a script that she's following, and she has specific statements that she's going to be using in order to be able to give Mom feedback on her particular use of this skill. So Alice?
Yeah. So so this is a demonstration of OASIS Parent Training through telehealth. And again, as I mentioned, OASIS Parent Training can be done in person as well. As an OASIS Parent Coach, I've done that both. And then, before COVID and after the COVID, just like every other services, we were, working from home and having restrictions of seeing patients in person. So everything just changed and everything was kind of in isolation. And then to our surprise is that, we got a lot of training inquiries to our parent training, OASIS Parent Training program, but also to our OASIS Parent Coach Training program as well. So we're not only providing OASIS Parent Training as a clinical service, but as part of the research and also dissemination effort, we are also trying to train more providers to be OASIS coaches. And we also got a lot of inquiries from insurance companies and trying to figure out, how they can figure out services that can be available to their customers, families of children with ASD who can continue to have care during COVID and during outbreak. So in addition, really, we also, as part of clinical services, we also transitioned a lot of the services to telehealth, just like a lot of other services earlier Dr. Nelson mentioned as well, direct service, consultation, parent training, sometimes assessment, evaluation as well. So a lot of the things were transitioned due to telehealth, and which really is a great, it's a challenge, but also provided us an opportunity to expand the training that we provide.
So, but before we move on to the next slide, the other thing that I want to say about this as well is that with the permanent AMA codes and the 97156 code, the parent training code, one of the things that that trained OASIS coaches have been doing is getting authorizations for parent training to be able to address their wait list or families that are on their wait list. And specifically with regard to the insurers, we've had insurers that have heard about the OASIS Parent Training Program, and they are calling us and connecting us with other BCBAs out in the field who are very interested in having a structured parent training program, right? So like Alice was saying, not only are we getting these increased inquiries, but we're also getting BCBAs that are interested in using this to be able to help address their wait list.
Absolutely. It actually reminds me that one of the training we had was originated from an insurance company call to try to find resources for their service providers.
Mm-hmm.
So Dr. Heitzman-Powell is going to talk a little bit about the scaling up strategies.
And so one of the things as OASIS and the parent training program started to grow and expand, people are a little bit excited about it, really. And I am, full disclosure, we're the ones that developed it, right? But one of the things that we found is that we were then starting to get a backlog, right? So if we're the only ones that are doing OASIS parent training, then OASIS Parent Training is only going to reside here at KU Med Center. And that means that there are all these families out there that don't have access to services because we don't have the capacity to be able to serve them, right? So subsequent to the development and testing of the original OASIS Parent Training Program, we applied for funding and we were successful to scale up OASIS. So one of the things that we did was we looked at how can we use our science of direct instruction and active learner engagement to be able to teach other people how to be able to implement OASIS with the same level of fidelity that we implement it here as the developers, right? So that then other people out in the field can take this curriculum and use it and be able to produce the same kind of outcomes in their parents that we produce here. So in order to figure out, as a behavior analyst, I'm not really good at that, right? I'm not good at scalability. I'm not good at dissemination, like in terms of like getting the word out and tooting my own horn and doing that whole thing and saying, look at this product that I have. So what we did was we went to the World Health Organization and looked at some of the guidelines that they had for strategies to support expansion and sustainability of a program post grant funding. Often what happens is people develop these really cool programs, the grant funding ends and the program goes away. Well, I didn't want that to happen. So we used the WHO model, applied for funding to be able to teach other people how to use this, and we were successful. So the things that we decided that were important were that we had to have a plan for scalability, But not only that, we had to be able to work with our end user organizations or OASIS coaches to be able to help them build the internal capacity to be able to use this, not as an add-on program, but as a part of standard practice, right? And part of that was being able to help them assess their environment. Do they have enough hours to be able to send people through the training? Help them make strategic choices that can help support the institutionalization of OASIS within their organization itself. And then choices to support expansion and replication. So with regards to expansion, one of that is working with the insurance companies to get them to recognize the OASIS Parent Training Program as a viable 5-6 option, which we've been fairly successful at doing that, both with the MCOs here in Kansas and then with national insurance companies that reach some of the other areas that we'll talk about in a minute. But then the other thing is replication. So I can say, yeah, this is a great program, but replication, as we know, lends strength to the science. So we've had a replication study that was done in Southern Illinois University, and that's waiting to get published. And then we have another replication site in Gainesville, Florida, at the University of Florida. And so it's currently in the process now of replication. So as we look to expand it and build it in as a clinical service, at the same time having the scientific replication of it, it continues to add strength to what we're doing. So when we're looking at specifically those strategies to support scaling up is we looked at systematic coach training. Excuse me. And so there's a couple of different things. Like I said earlier, the content, which was if this is being used by BCBAs, most of them are going to have, or they should have, the underlying knowledge, excuse me, that they need of the science. But the biggest thing is the distance-based delivery. Like, I don't know how many of you were on for Evelyn's presentation just a minute ago, but being able to deliver a professional intervention or session, telehealth session with a family using behavioral skills training and with descriptive labeled praise statement and corrective feedback is difficult. It's not something that we were taught in our pre-service training. It's very difficult. I always early on found myself getting closer and closer and closer to the TV screen because I really wanted to just jump through there and say, hey, look, this is how it's done. We have to maintain that 4-to-1 praise to reprimand, right? So, or praise to corrective feedback, so that we're making sure that we're attending to, for the parents, the behavior that we want to see, which is their appropriate use of contingent reinforcement, catching their kids being good, right? And so being able to give that descriptive labeled praise statement to the parent in the moment is a skill that we work on during our coach training. Some of the things that we do is we call them soft skills. So where we teach active listening, working in collaboration with the parent, and then building rapport with both the parent and the child. The other thing is that for that coach training sequence that we have individualized technical assistance, TA, for folks as they start to implement OASIS within their agency and organization. So it's help developing treatment plans that are focused specifically on parent training to be able to help address the wait list. It's to be able to have maybe a targeted intervention for a family that has a kiddo that maybe doesn't need EIBI, but if they had some parent training, then that would be able to help support that family. So being able to work with the BCBA or the OASIS coach to work with the insurance company to ensure that we can get an appropriate authorization for that. And then if they do bill and they have any trouble with it, we also offer advice and assistance with that as well.
Linda, we've had a couple questions come in
Sure.
specific to coding. Would this be a good time to answer those?
Yep.
Okay. So the first one is, with this model, would you then be requesting more 56 code than 55 code. For example, currently in clinic, I only get 2 hours of 56 per month, but 21 hours of 55 per month.
Yeah, we get 2 hours of 56 a week. So we definitely, and like I said, the insurers, especially here, are becoming familiar with us, and they know me, and the MCOs, they all know me, and so we have our bridge clinics here, and as a part of our bridge clinic, we also do the OASIS Parent Training program, and we request 2 hours a week. And I know with some of the nonprofits and the other OASIS coaches that I work with out in the community, they're getting 2 hours a week of parent training.
Okay.
Yep.
And we also do, we have an OASIS outpatient clinic as well. So we do provide OASIS services to families who are not currently in our clinic. So with that, we request 97156 only. And sometimes some insurance companies may ask to request 97151 to do an assessment first, and then request 56 just for parent training without requesting 55, because they are not in our clinic. The children are not in our clinic actively. The primary client of our service was actually the parents.
Yeah. And so there's two things. So if you're doing it as a standalone to address your wait list, you probably would have to do the 5-1 first. And the feedback that I've gotten during meetings with the MCOs here in Kansas is part of that 5-1 code could be the administration of the Vineland. And then you could select global child skills. Part of in the first couple of sessions of OASIS, you're talking to the parent about what their main concern is. And so you're identifying a child behavior that you're going to address throughout the whole training, right? And so you can use the 5-1 code to administer the Vineland in that first 1 or 2 sessions of OASIS to get the parent goals. And then when you submit for the 5-6, then you can include the parent goals for OASIS as well as a child outcome goal. And that has been the feedback that I've gotten about that. For kids that you have that are in intensive IBI, intensive behavioral intervention, if you say that you want to implement the structured OASIS parent training program, you can increase the number 5-6 hours that you get to about 2 a week. And then you can still have your 5-5 and everything else in addition to that. Unfortunately, I'm very fluent at that.
It sounds like you've become part of the insurance world, Linda.
We have.
You have an honorary degree.
I do an honorary degree in insurance coding.
Kind of going back to that 97156, Allison asked what was the concern about using that? Was there any materials that you'd be able to share if someone's using this model for PTing in the case of denials?
Yes, I think we do. I remember we had one, like Linda and I had to sit in that peer review, and we were able to provide them with we have a template of assessment report, and we can get back to them, and then we have the literature cited for OASIS parent training and things like that, and the insurance company has been fine with us. Linda, do you have anything else to add?
No, I would say that that it was early that we had some pushback from insurance companies about it, but as soon as we provided the documentation for what exactly it is that we were doing during these parent training sessions, most of the peer reviewers tended to be more impressed with what we were doing instead of not impressed. And so we do have that template that we'd be willing to share, because my whole goal is that we can get this out to help, right? And it's not going to do us any good if all we do is leave it on the K Med Center server. So if you guys know how you request a copy, Would that be something?
I think the template is quite specific to OASIS. You know, we would love to train you to be OASIS coach, and then you know, and provide that technical assistance.
Yeah, I mean, that's part of what we're funded for, right?
Yeah.
So news for everybody that's on this call is that right now it is still grant funded. So the training, you have to invest the time in it, but really the training's free. And you come out the other side saying you're a certified OASIS coach, and then you have access to all our materials, which includes that parent training authorization template.
Yeah.
So,
Yeah.
So when you know this was there another question, Sarah?
No, okay. There are not. Yeah, thank you.
You're welcome. So, you know, our coach training structure, the way we developed it was the same as we developed the parent training, right? Where like participatory action research, which is where you get participants to come in, you know, show them the materials or they engage with the materials, then they give you feedback. And then we revise it based on the feedback until we end up with a product that functions as intended, right? And our last iteration of this was with the group in Florida, where it was a BCBA-D instructor plus 3 of her graduate students went through and really provided really good feedback on the materials, et cetera, et cetera, et cetera. So the coach training is pretty much just as solid now as the parent training is. Initially, it was like a week long. We did a distance-based thing or a stretched out thing where you could take it at your leisure over 3 to 6 months. That didn't quite work, right? And then COVID happened and boom, it was all transitioned to online. And now we've got it, we're like a well-oiled machine, right? We've got it down to a 3-day training delivered via Zoom in a group format. And then there's 2 additional trainings that there are activities that you do, like scoring videos and sending them in and getting feedback on it, that sort of thing. It's criterion reference, so you have to meet a criterion in order to be able to move on and get your certificate. So we're ensuring procedural fidelity with the use of the curriculum before we actually award a certificate. It's really kind of exciting. It's fun.
Yes.
All right. So here, do you want to talk a little bit more about the training, how it goes, Alice?
Yeah, absolutely. So we have been doing a lot of trainings, you know, since COVID through Zoom and all distance-based technology. So, so the kind of the structure, the format of the training, we have been able to do it in a group format, up to 10 people. So the way we can do it is that me and another great trainer, Vanessa, we do it like we use the feature of breakout room. I'm sure like a lot of you are very familiar with the breakout room feature at this point. And it is really helpful. So we can each have up to 5 people in that room. And we can train. I don't know what happened, but there was some echoing. Sorry about that. So we can train up to 10 people per group, which has been super helpful in terms of making sure we can train enough people, but at the same time, being able to allow each trainee to have enough time to have that one-on-one feedback. So what the training looks like is that we usually have like a 3-day training that we are meeting on the Zoom. In addition to that, 2 days, they are doing things on their own. So day 1 and day 2, there's some lecture and some skill assessment scoring, as Linda mentioned. You know, you watch videos of how some previous OASIS coaches have, parent training coaches have coached the parents so that they can, you know, they're not only learning how to implement the program, they also learn to see, okay, whether this OASIS parent training coach is doing exactly what they are supposed to do based on the task analysis. Also, they are practicing effective feedback So they need to learn how to give that effective feedback. As Linda mentioned, that 4-to-1 ratio, right? That positive praises, label praise in addition to some corrective feedback. And also like coach statement fidelity. So I feel like we should have some screenshots of our manual. That's something we do next time. So basically, for a coach, we have the task analysis that we are able to assess while we are working with a parent. We are able to use that to assess parent skills. But also while we are coaching parents, we are able to tally ourselves in terms of how many coach statements we are delivering per each step of the task. So that has been super helpful to train them on that as well. And then the day 3 is usually the most exciting day, because after they learn all those things in day 1, day 2, day 3, they get to co-lead with other trainees and being able to lead different sessions, and then doing some independent sessions as well. And also we always enjoy having discussion and hearing feedback, and also just knowing how they plan to carry the skills they learned and use OASIS in their practice or in their learning as well. So yeah, a lot of activities, and the using Zoom has been surprisingly efficient for that purpose. And another thing just want to mention is that some of the activities we do here, like for example, like the co-lead and independent sessions, they are actually giving practice being an OASIS parent training coach, is that we are able to use the kiddos in our clinic and to practice those things with real child, and not a real parent, but our very proficient providers who pretend to be parents. And we also target on a lot of key competencies, but they kind of fall into 2 categories. So first, definitely behavioral knowledge. A lot of all the trainees, they already have prior knowledge and experience with ABA and the language, the skills, but we still want to make sure that they meet the preliminary requirements for our training purpose. And also they are learning soft skills, kind of like Linda mentioned earlier about active listening, learning to build rapport with parents and sometimes children as well, and learning how to collaborate and giving feedback. That's all part of soft skills. Another thing that we also really try to.
Sorry.
Do you want to add something?
No. I thought you were done, so I was moved the slide.
Oh, okay. Yeah. So some of the things I already touched on in terms of we do skill assessment and coach statements. So I will not elaborate on that. So the skill application part, I will also mention that. I just want to mention that's a really good learning opportunity for our trainees. And sometimes it can be a little bit daunting, because you're not only doing that in front of us as trainer, but also your peer trainees. So it's a little bit of anxiety there, but usually it's really because it's a 3-day training, so you build that rapport as a group, but also you are getting more and more comfortable in doing those type of mock training or practice sessions. So but usually they really learn a lot through those kind of training, that they can get feedback from the trainers, but also observing how their peer trainees, how they do those practice as well. Yeah, we can move on to the next slide. Yeah. So this exciting thing that Linda and I mentioned, in terms of how our training just blossomed during this time when there's so much isolation, some restrictions on in-person services. We have been able to conduct 15 trainings. Think about each training has at least 8 to 10 people, and then those trainees are from many states across the United States. And Vanessa, another trainer, and she's also self-taught, like what is that, programmer who helped us create this really awesome map here. As you can see, we trained trainees from Washington State, Georgia, a lot of other states as well. And also on the right corner here, it really shows our connections with other countries as well. So like Turkey, Poland, and we just had a meeting with someone in Qatar who is interested in our training as well. So yeah, Linda, do you want to add anything to our?
No, I just think it's really fun, right? Because we've got this part of the United States covered right here. We need to get some people in. Oh, we've got somebody in Alaska, or not Alaska. We do have somebody in Alaska that was trained. That's not on here because that's down here. We have somebody in Hawaii that has reached out to us to be able to help because, as an island state, they are really remote, right? So they're very, very interested in OASIS. But if we could get somebody in San Diego, then we have to do an in-person training in San Diego.
You can go with your hometown.
And then, so we have trained people in Poland, and they're interested in becoming trainers so they can start to train other people in Poland, which is the next grant we're going to talk about here in just in a minute. And then again, Turkey as well. So it's kind of fun.
Yes, absolutely. Just really quick, since we already touched on this, in terms of what we teach, we really root in all the things we teach really roots in applied behavior analysis and the behavioral principles, evidence-based research, literature. So we teach parents those skills just as we teach, the parent training coaches those skills as well. So there are 24 content areas, and we break down those content areas really to like each step so that parent can implement those, parent training coaches can coach on those steps. So it'll be specific and concrete as well. Yeah. So
we do have a couple of different competencies that we look at, because not only do we look at procedural fidelity, but it's criterion referenced. And so the two competence areas of competency, like what Alice was saying, are those things that we call hard skills. And that's the verbal behavior, the coaching statements that we train our coaches to use. But again, like I said earlier, it's also those soft skills where they're looking at active listening, collaborating, that the parent is a collaborator, right? And then building rapport with both the parent and the child.
Fun video.
Yes. You want me to just go ahead and play it? Hillary, if you're on here, I think you have to mute me. I tried to mute myself before and it stopped the video.
While Linda is playing the video, I just want to give you a little bit of context here. Again, this is a video of a parent training coach training. So basically, we have a provider and a child in the clinic, which is on the top left corner. And we also have the bottom side, which is our provider, Cassie. She is, acting like the trainee who is being trained to coach. And then we have Vanessa, who is the other OASIS trainer, who is providing feedback to Cassie in this process.
While Linda's doing that, Alice, there was a question that came in that you might be able to, I'm confident you'll be able to answer. Do you have a way for clinicians to identify individuals who are trained in OASIS? So if this person is, she diagnoses, so if she diagnoses a child and she's looking for services, how can she connect them to an OASIS provider?
Yes, absolutely. As always, we welcome anyone to contact us directly. But also we have an OASIS website that we list all the people we trained who have a website. So I will put that. Linda put it in the chat earlier. Let me see whether. Let me put that in the chat so that you can. So it's oasis.ku.edu. That is the website, and you can find a lot of information about our training and different types of training, because we offer a lot of trainings in addition to this coach training and parent training. And also there is a tab called Find a Trainer, and then on that tab you can see all the listed certified OASIS parent training coaches from Arkansas, Florida, Georgia, and a lot of other areas as well.
I'm going to try it this way. I swear, you guys, it worked this morning and it worked yesterday. Well, in order to avoid.
Linda, do you want me to try to share really quick?
Yeah.
And if it doesn't work, I guess we can move on.
We'll just move on.
Yeah, I was going to say, it sounds like Linda might be suffering from some slow speed issues.
Okay. Sounds good.
Thank you, Kate.
I don't know why, but it seems like it's. How about this? Oh, it's playing. It's loading a little bit. It's a really great video, so I really want to.
There it is. Can you make it bigger?
I was going to say, it's kind of small. You might try sharing the link, doing the direct link route through the YouTube button.
Hear it?
No, there's no sound.
There's no
So-
sound.
All right, let's just move on. We'll just put
Okay.
that.
I will put this YouTube. I will put this YouTube link in the chat section, and feel free to go visit it afterwards.
So, Alice, do you want to go ahead and share your presentation, or do you want me to?
Can you share, since I'm gonna try to put the chat in the chat.
All right, so some potential barriers to scaling up, because part of the success of any scaling up program is identifying barriers. So I'm talking about, some of the barriers to implementing a scaling up program.
Linda, I think you might need to get out and come back in. Your connection, it seems very tenuous at this point.
All right, so Alice, I'm going to let you finish it out.
Okay. Am I echoing as well?
No, you sound fine.
Okay, good. I just felt like, when we are having a virtual conference, it will be weird if we don't have any technical difficulty, right? And we're having it here all in our last session here. So I appreciate everyone being patient and, sticking with us. I think Linda was trying to talk about barriers, right? I think what we just experienced can count as a barrier, right? Because although Linda is at the University of Kansas Medical Center, supposedly she should have really good connections and having really good internet, but still, and I'm at home, and we both have some technical difficulty. So in terms of barriers, I do think, although technology is a great way for us to, break the barriers, but at the same time, there are barriers for us to use technology to break the barriers, right? So especially a lot of the rural areas and underserved communities, technology itself can be a barrier. So for example, when we were doing, we were providing services during COVID, when we were not able to meet in person, a lot of the families we served, they only have one cell phone they can use for services, which poses a lot of challenges. Like, for example, if they have a phone call come in, then basically we lose their entire image if they have to take a phone call, or they just have to, even hang up the phone call. So those kind of things. So again, there would be some challenges with technology. So Linda, do you want to speak now?
How do I sound now? Better? All right. So, these are barriers that I've come up against. Some of the continued barriers is the time that it takes. It's release time, right? I just had this conversation with somebody that's all excited about OASIS. And I said, well, you have to be able to make sure that your staff have that 3 days to be able to come to the training, right? So you're going to have to, instead of being an add-on where they still have to have 25 billable hours a week plus come to training for 3 days, you're going to have to give them release time to be able to come to training and reduce their billable requirements for that week. That costs agencies money. So even though the training itself is free, there is still a cost to that. And so that all has to be taken into consideration. The other things are, what are the credentials that you need to be able to bill? So for two of us here, Alice and myself, we're BCBAs, and we can bill the 97156 code. Vanessa Snyder is a licensed master's level clinician. And even though she's fluent in OASIS, she doesn't bill the 97156 code. She bills traditional psych codes, right, for family therapy with child present. And so you have to make sure that the people that are going to be administering OASIS have the credentials necessary to be able to bill. That's one of the things that we had in place from the very beginning, was an eye towards sustainability. You have to be able to bill for this. Now, the Alice covered technology needed. Now, the last bullet point on this slide is continuity of care. So if you remember, one of the first slides I had up was a time machine where we went back in time to pre-COVID. And part of the discussion that I was having with insurance companies at the time was the ability to be able to bill for telehealth. Well, post-COVID, we're now able to bill. Well, most of the restrictions that have been lifted on telehealth delivery for intervention are temporary. And so it really is going to take continued advocacy to ensure that our ability to deliver services, whether it be 5.6 or 5.5, right? Or in some cases 5.3 via telehealth, that remains a permanent telehealth option instead of just in the realm of temporary codes. And then the next thing is that it's fine for us to train coaches, but you guys saw all the different areas that we've trained so far, and the fact that we also have been training in Poland, and we're going to be training in Qatar and Turkey. Eventually, we're not going to have the capacity to be able to train more coaches. And so one of the things that we're doing now is developing a sequence where we can train other people how to become coaches, they can hold sessions and webinars or workshops and be able to train a new cadre of OASIS coaches themselves, right? And so when we're looking at scaling up, it's definitely the train the trainer model where, you know, they have their knowledge competencies and not only the behavior analytic terms and the science behind it, but the knowledge of how to be able to train others to be coaches. And then again, those hard skills like training others on the platform, how to use the platform, how do you navigate through the online portal, how do you read the manual. For anybody that's familiar with capital D, capital I, direct instruction, and like reading mastery, it's set up just like that, right? But it's training people how to be able to use that curriculum. And then of course our soft skills. And actively promoting behavior analysis in a way that's good for consumers. So as Alice was saying earlier, some of our current OASIS implementation, we have clinics here at KU Med Center. We've been training families. We have direct service providers that we train still throughout the state. We are training others to be train the trainer. And then we continue to do that OASIS coach training. So I want to say sorry for the technical difficulties because this is a good video. I'm going to go ahead and try to start it one more time if anybody can hang on. And if not, then I'm willing to entertain questions. Did you see that? It acts like it wants to work. Silly thing. I'm going to quit sharing. Share again with audio. It's thinking. Anybody have any questions while we're up?
Okay, Tiffany, so it looks like we're going to jump right in.
Linda, we don't see
Okay.
no.
Okay, so why don't you go ahead and get started and I'll kind of coach you as you go.
Okay. All right, Parker. A keyboard? Yeah, a keyboard. All right. Okay.
Well, actually, before you get started, Tiffany, let's structure our environment just a little bit better. I see there's a lot of stuff on the table. Maybe once you establish your reinforcer, let's set either the apple or the puzzles off to the side and make sure all of the teaching material is only near your reach as well as the reinforcers.
Parker, which one do you want to work for? The keyboard? Okay. The timer now. Okay. All right. Timer it is.
There we go. Thanks, Tiffany.
There. All right. Okay. Yes. Oink, oink. Yeah. Say, wet. Good. You got all of your tokens.
I'm going to jump in real fast. The first thing is before you start the token system, let's just remember to explain the token system before. So you want to make sure that the token gets paired with the reinforcer so he knows when he gets the token, he also gets the reinforcer. Also, remember when we're first starting a token system that we only want to start with one token on the board. And it looks like you had 2 tokens.
Okay, two of them off the board.
Yeah, so he'll only have to earn 1. So just 1 token. Yep.
Okay.
And we can try that again.
Sure. All right, let's get our timer to our zeros. Let's work for our timer. So you're gonna get a penny every time you get the right answer. And once you get all of your pennies, you get to have your timer. All right. Who is this? It is a teacher. Great job. You get a penny. All of your pennies you get to have your timer.
That looked better.
Thanks.
Welcome.
All right, Cassie, I took some notes So overall, that looked really well. I like how you did an awesome job responding to a teachable moment during that session, where you gave Tiffany some feedback on how to best structure her environment before teaching Parker. I do want to make sure that you are using a 4-to-1 ratio of positive feedback statements to corrective feedback statements. So it looks like you gave some corrective statements on describing the token system and then starting with the 5 spots and 4 of them filled. But we do want to give her some praise for the areas that she demonstrated during that activity. Also, I did like how you gave her a practice opportunity to implement some of the strategies that you had talked to her about. So let's go ahead and we'll try that again for the next activity. Thanks. You're welcome.
Success. So add is that there's it's a triad, right? So Cassie is the coach, is coaching the mom, and then Vanessa is teaching Cassie how to be able to be more effective in her delivery of feedback to the parent. And so that's our part of what our coach training program looks like. So having said that, and thank you for those of you who hung around to look at that and being a little bit being lenient of technology.
We are behind now.
Are there any questions?
There are not. You guys answered everything throughout the session.
Awesome. So the one of the things that I would like to show is Alice had talked about it a little bit. This is our website. Like Alice was saying, I'm at Katie Med Center. You'd think it'd come up here. And go to trainings. And which training is right for me, and you can pick one by clicking on the link at the bottom. If you wanted to find a trainer, here are the people that have, or the agents trained. Georgia, Missouri. So you can get online here and find a place to either become a coach, or if you want to refer a family to somebody that's already been trained, you can find it here. Thanks very much for coming to our session today.
Thank you, Linda and Alice.
Except for the fact that the video. Thanks, Sarah. Except for the fact that the video didn't work. So,
and I think Sean had made note, I think there's a session on the main stage, family resiliency and COVID-19. So if anyone's interested in that, you can hop over to that session. Okay.
Great. Good afternoon and good weekend.